Drex, you're one of the most recognizable faces in healthcare cybersecurity. Your CV is incredibly in-depth. You've led IT, you've held CIO roles at multiple hospitals. In your current role, you're holding important conversations with the folks that are leading the charge on the ground, which is important. I think that the more we talk about it, the more natural things become, threat sharing and things like that. So our team is honored that you've joined our board. What inspired you to join our strategic advisory board?
Yeah, so this has been a long journey for me, right? I was like you said, I was a CIO for a lot of my career, and then as an independent consultant, I sort of accidentally got into this cybersecurity space. I always had responsibility for cybersecurity as a CIO. I've just never actually done the role, but I wound up getting involved in lots of great companies. One of those was Synergistic and Mac McMillan, and so I was on Mac's board at Synergistic. And so when Mac called me, and of course I know Carter, I know a lot of the folks at First Health, you guys do great work. When Mac called me, Carter called me and said, we're putting together this strategic advisory board. We'd love for you to be a part of it. And he sort of listed out the names of the people that were going to be on the board between, of course, the team at First Health and the people that are on the board. It was a great opportunity, and it fit very nicely in this sort of idea of everything that I do ultimately is to try to create better, faster, cheaper, safer, easier to access care for patients and families. And it was a great match. So that's why I joined.
I think it's interesting because I never knew that you had that relationship with Mac. And I think that as one of the other most recognizable faces in healthcare, I think that that's kind of also a dream team as well. I bet you're glad to be back together again because he's obviously.
It is. I love the guy. You know, he's a Marine.
Yeah.
I'm an Air Force guy. There's a lot of jabs that are exchanged, but it's always a good time when you're around Mac. He's brilliant and everybody knows him. So a great opportunity to work with him again.
But yeah, touching on that, because you and I have talked about your non-traditional path into health IT and cyber. I'm always curious, and I think it's important when someone has had such a varied and important career. I think that it's always a good question to ask how things have changed since the early years, not in that sort of minutia, but more for the good, the bad, and the ugly, right? We're doing some things right, but we're still, horrifyingly terrible at other things, How have you seen that change? And, where's that concentration,
It is interesting to think about, sort of from the early days of healthcare IT when originally there were computers maybe in supply chain and that was it. And then email came along. And then obviously as we moved through all of this, the threat landscape continued to evolve. And sometime in the 2000s, we had our first couple of opportunities with ransomware. 2008 ARRA and the implementation of meaningful use in electronic health records across the board. Adoption of EHRs went from 10% to 95%. And that just created this whole environment that we're tied into today. And as the bad guys continue to see those opportunities, especially with electronic health records, especially around third parties, as we've seen recently, instead of breaching 100 different health systems, you can just breach one third party and get access to all of that data. All of that landscape continues to change. The bad guys become more sophisticated. Where we used to have an opportunity when there was a hack or a breach or something started, we could take some time to sort of resolve that because the systems weren't that important, honestly, in the delivery of care. Over the last several years, it's become critically important. Those systems are now integrated into the way that we provide good, fast, safe healthcare. And doctors and nurses and lab and rad and pharmacy and everyone else can't really provide that kind of care without those systems being online. So the speed at which we have had to find the bad guys, address the attacks, understand all the relationships we have with everything on our network, everything third party, it's just become a very complicated, very important part of the business that we're doing now. The cybersecurity pros are facilitating great healthcare in our health systems. And I think they should think about that every day when they wake up. They're saving lives too. and it's an important part of that role now.
I don't want to go on a tangent, but I was actually thinking about because given the recent Change Health incident, I think there's been a lot of spotlight around third party and fourth party, nth party risk. And
Right.
just for me, the visual for medical device security, for example, has been this sort of like matrix of just like mass connections, everything is connected to everything. And I feel like when you add that third part, it's the same kind of matrix, right? Where it's this huge problem to get your arms around. And I think, I don't know, I'm curious to see if you've made similar comparisons in your mind, at least, to sort of the complexity of the problem and the importance of sort of shrinking that risk landscape, maybe.
I mean, a lot of it is sort of boils down to simplicity, right? The simpler you can make the environment, the more you can understand the environment, and these things kind of like go hand in hand. If you can understand the environment and everything that's there, and how old it is, because certainly security is very tightly connected to IT infrastructure, which is very connected. I mean, everything is connected to everything else, and so ultimately it comes down to if you can understand your environment uh, in real time and continue to sort of relentlessly focus on this idea of simplification. If you can do that, simpler is easier to secure. It's easier to understand when there's something weird going on in that environment. That could be a security incident, could also just be something going on with infrastructure that you need to address. But the simpler the environment is, the easier it is to understand those things, and the easier it is to sort of keep those systems up and running, which is critical to the delivery of care today.
And tying into that, I feel like I'd be remiss if I didn't ask about your current project. So I know you recently left CrowdStrike on a positive note to join the 229 community, and I think that your 2-minute drills really tackle some of the most pressing issues that are facing healthcare right now. And I'm curious, in an effort to cut through some of that FUD, what trends are you seeing right now that providers should be taking note of as we really kind of work on prioritizing risk, right?
Yeah, a lot of the stuff that we've talked about, I mean, a lot of it sort of boils down to being able to see what's on your network so you know what's there, and then sort of systematically addressing those challenges. A lot of this in healthcare is legacy infrastructure or legacy endpoints or legacy medical devices. These are things that we've had on our network for a long time. We're, as an industry, not ones to throw something away early. We use it until the very last opportunity, last gasping breath of that piece of equipment, and then we send it off and replace it. But that reality, I guess, that culture and maybe the fiscal necessity of doing that also creates a situation, an opportunity for bad guys. And so understanding everything that's there, understanding the legacy situation, and having a plan to replace those things over time, that helps you identify the risk that you're accepting in the environment and helps you understand the steps you should take to try to mitigate that risk. But that's one of the things I really see. I mean, I see folks working on this all the time. I think the cybersecurity situation in healthcare, while we still have a long way to go, it's not because people aren't working hard. These are some of the smartest, hardest working people I've ever met. It's just a tough situation right now between the legacy stuff, between the environment that we're in, between the fiscal constraints that we have, and the target that we have on our back from the bad guys. There's a lot going on here.
I appreciate all that you do for healthcare. Thank you.
Thank you very much. I appreciate being on.